Hello everyone, welcome back to our series Disease and Their Drug series. Let's discuss the case of diabetes mellitus type 1. As we know that diabetes mellitus type 1 is also known as insulin dependent diabetes mellitus. Insulin dependent diabetes mellitus means it depends on the insulin concentration in the human body, or it depends on the insulin. Now, it is an autoimmune disorder. Destruction of pancreatic beta cells happens in the type 1 diabetes mellitus or insulin dependent diabetes mellitus. It leads to absolute insulin deficiency. In this, there is deficiency of insulin in the human body. Now, pathophysiology, when we talk about its pathophysiology, so beta cell destruction. In this, there is beta cells destruction happens in the islets of Langerhans of pancreas. No insulin production is there because beta cells are destructed, so there is no insulin production. Hyperglycemia develops. Hyperglycemia means increase in the concentration of glucose in blood is hyperglycemia because insulin is not produced in the human body. Now, signs and symptoms of type 1 diabetes mellitus or insulin dependent diabetes mellitus is known by 3P. 3P means polyuria, polydipsia, polyphagia, weight loss, fatigue. I will explain all these symptoms. First of all, polyuria. Polyuria means excessive production of urine. Polydipsia means excessive water intake. Polyphagia means excessive food intake. Now, when we talk about diagnosis, now how we diagnose this disease? So, for the diagnosis of type 1 diabetes mellitus, fasting blood glucose, if greater than or equal to 126 mg per deciliter, you have to consult with doctor because it's a symptom of what? Type 1 diabetes mellitus. If your HbA1c is greater than or equal to 6.5%, then it is a diagnosis of type 1 diabetes mellitus or insulin dependent diabetes mellitus. Autoantibodies present. If there is a presence of autoantibody, then there is it's a type 1 diabetes mellitus. Now, management. How you manage type 1 diabetes mellitus? So for the management of type 1 diabetes mellitus, insulin therapy is essential. Insulin therapy बहुत जरूरी है. Dietary management. Your diet plans is also important. Regular monitoring of blood glucose is very important. There are many instruments like glucometers, Dr. Morpin, Contour. They are basically used for the monitoring of blood glucose in the human body, in the blood. Now, types of insulins. So in the types of insulins, you have to classify insulin on the basis of their duration of action, onset of action. So, rapid acting, short acting, intermediate acting, long acting. One is also there, ultra long acting. Example is Degludec. Now in rapid acting insulin, you have insulin Lispro, Aspart, Glulicin is also there. Onset is 10 to 30 minutes. Duration is 3 to 5 hours. In short acting insulin, you have example regular insulin or soluble insulin. Onset is 30 to 60 minutes. Duration is 5 to 8 hours. In intermediate acting insulin, you have example NPH insulin, neutral protamine hydrotron insulin. Onset is 1 to 2 hours. Duration is 12 to 18 hours. In long acting insulins, you have examples insulin Glargine, insulin Detamir. Onset is 1 to 2 hours. Duration is up to 24 hours. Ultra long acting, मैंने आपको पहले बताया example. Ultra long acting, as I told you previous, insulin Degludec is ultra long acting insulin. Conclusion: type 1 diabetes mellitus requires lifelong insulin. Yes, type 1 diabetes mellitus always requires lifelong insulin. Different insulin types help in glycemic controls. Different insulin types are there, which you understand previous, like rapid acting, short acting, intermediate acting, long acting. These insulins are used for different glycemic controls. Or what? These different insulins are used in the glycemic control. Thank you.